So today I'm going to be talking about superficial partial thickness burns. So pretty much the cause of this type of burn, like many burns, is there's scalding burns. There are burns that come from flames. There's burns that result from radiation, chemicals, and also contact or friction burns. So the most common type of injury that occurs, like specifically with burns and superficial partial thickness burns, is your scalding burns. And so this occurs when you come into contact with some type of like hot liquid. The severity of a scalding burn just depends on the temperature, the viscosity, and the duration of exposure. Another thing to keep in mind is like depending on whether you have clothes on can determine if you have a worse burn compared to another, because clothes usually retain heat and they are in contact with your skin. So if you have clothes on, you're going to have more extensive injuries. The presentation of a superficial partial thickness burn is it's going to be very sensitive. If someone were to apply pressure to the area, it's going to appear blanche or white. You are going to have a lot of blistering with your superficial partial thickness burns, as well as intense pain, arrhythmia, and sometimes weeping, depending on the person. Specifically, superficial partial thickness burns, sorry, that's a mouthful. They involve your epidermis and your superficial dermis, more specifically your papillary region. Like I said earlier, you will have blistering, and this is due to the local inflammatory process between the dermis and the epidermis. Usually, your healing time with these types of burns is 2 to 3 weeks, and they rarely have any type of hypertrophic scarring, wound contractures, and they don't require any type of excision or grafting, which is good because it is superficial. Depending on the person, you may have some type of changes in your pigment, or you might have severe swelling. You may display some type of fibrinous exudate, and this is going to be where your necrotic debris can accumulate on the surface, which could lead to bacterial colonization and delay the healing process. I couldn't really find many laboratory tests besides just like running like your typical screens in your labs. And if you were to do that, you can look at your electrolyte levels, creatine, glucose, CBC count, as well as your coagulation profile. So you could pretty much you'd be using like all of the things that I just listed to check fluid and protein retention, because with your superficial partial thickness burns, that is a big concern. So my examination is going to, first I will conduct an initial assessment. And so I'm going to ask the patient for their previous medical history, just to kind of look into their past and see if they've been to the hospital before, like if they have anything, any type of previous burns. I'm also going to be looking at their comorbidities. Their comorbidities could result in delayed healing, so just asking if they have any type of cardiovascular problems, any type of diabetes. That will be very important, just so I can understand in my head like what we need to do in the future, and it'll help me develop my treatment plan. And I will also ask them about their current medication as well, because that goes along with just their their healing process and seeing if it's delayed or if it's going to go smoothly. Some tests I'm going to do is I'm going to do a burn evaluation. This is going to determine the severity of their burns, because there is a spectrum. I'm going to determine the total body surface area, which is also known as the TBSA. Along with determining the TBSA, I'm going to look at the rule of nines. So the rule of nines divides the body into different sections depending on if you're adult or a child. We're going to be just looking at adults just because that's what we're talking about right now. And so the rule of nines is going to, like I said, divide the body into sections. And depending on the severity and the amount of burns in each section, it can determine the degree of the burn. So that's something that's very important. And I'm definitely going to do that first just so I can know what we're dealing with. I'm also going to do an ABCDE evaluation. And so this checks an individual's key body systems and their functions. So A stands for airway, B stands for breathing, C stands for circulation, D stands for disability, and E stands for exposure. So I would pretty much just go down that list and ask my patient in exactly the same way that I did with you. And I would pretty much just like ask them those questions just to make sure all of their systems are working correctly. Especially with burns, this could be somewhat difficult because they may not be displaying any types of problems at first and they may just come on later, but I just want to make sure to clear all the systems. Like I also stated earlier, retaining fluid is kind of hard for someone with a superficial partial thickness burn. And so just checking their fluid retention will be something that's very important, and I will ask them in my just examination of them. I'm going to be looking at their fluid and protein leakage to determine if they have any type of burn shock. I'm also going to use the Parkland formula in my fluid requirements test, and that's going to be an estimate of the fluid requirement in relation to the body surface area of the burn as well as the patient's weight. So yeah, those are some of the things that I'm going to be doing. Some interventions I can incorporate. I'm going to first be looking at some of the goals that I'm going to create. Initially, I feel like I'm going to want to prevent burn shock, the thing that I mentioned earlier. I'm going to want to relieve pain and discomfort, as well as reduce the risk of infection. I'm going to distribute some dressings for my patient, and this is going to be silver impregnated gauze, and I'm going to distribute this so I can decrease the frequency of dressing changes for my patient, as well as providing adequate antimicrobial coverage for their burns, while also allowing a moist environment and elution of active silver, and the silver is going to protect against infection. So yeah, I'm also going to give my patient some ointments and creams just to make sure that, the wound isn't getting infected. I'm going to distribute silver sulfadiazine. I think I said that incorrectly, but it's also commonly known as just Selvadine, and this is commonly used and most widely used for burns. This has a broad spectrum coverage as well as it limits potential to penetrate burn eschar, so it's very ideal for the superficial partial thickness burns. And I'm also going to be distributing malphonide acetate, which is, like I said, good for the superficial partial thickness burns. I know I stated earlier about how most of the time with these types of burns, there won't be any wound contractors, but I'm also going to just make sure that I emphasize range of motion for my patient while doing the interventions, because I don't want them to have any deficits, like if we don't emphasize range of motion. So some of the things that I'm going to educate the patient on, and as well as their families, like, this is going to be very difficult and you are going to be in a lot of pain, but we are going to get through that together. I'm also just going to emphasize pretty much pain control and relief with those ointments and creams that I'm distributing. It helps with infection, but it also is going to be a source of pain relief. I'm going to make sure that they do not open any blisters when they're at home, even if they want to or even if they're tempted. This is due because to the fact that, like, if you were to open a blister, it increases your risk of developing some type of infection or having some type of bacteria enter into the blister and into your body, which is very bad. So I'm going to inform them, do not open any of the blisters that develop on top of that wound. I'm also going to educate them on properly managing their dressings, making sure they change it often and on time, and make sure that they're properly putting on the dressing, because we don't want that to cause any type of problems either. I'm also going to be emphasizing nutrition. Like I said, it is a 2 to 3 week healing process, and so we want to make sure that we don't hinder the healing process at all. So we want to have nutrition that incorporates, important minerals and important vitamins. And so I I'm going to use a combination of the Curacy, or Cure, I'm sorry, I cannot properly say this, Cure formula. I'm so sorry I butchered that word. As well as the Harris Benedict formula, and this is going to prevent protein catabolism and muscle wasting. So some types of referrals that I can use is I'm always going to refer to a primary care physician if I need to, and maybe like if they do need to go back to the intensive care burn unit, they can, and they can have the resources for that, but I'm not really sure if I really need to do a referral, just because once they come to me, hopefully, like they're in a place where they can start physical therapy. But if I do need to refer, I would refer just back to their primary care physician, just because they probably have the right resources and contacts to send them where they need to go. Lastly, equipment. I'm going to make sure my patient has, like I said, dressings, and knowing how to properly use those dressings and change them out. I'm also going to be giving my patient creams and ointments, and this will be for pain relief and preventing any type of infections. Those are kind of the two things that I want them to have the most. Other equipment might be more beneficial, but those are two things that I definitely want them to have. And that is all of my questions. I mostly got my information from the book. I also used Medline as well as a wound source website that gave me a lot of good information. So thank you for sitting through my presentation, and I hope you have a wonderful day, and thank you for watching.